Well, very much carrying on from the last panel, we know that health literacy is the foundation for people to make better choices about their health, but too often it's overlooked. Today, we're going to explore how Portugal has made literacy a national priority and what more can be done to incentivize individuals to truly take ownership of their health. So I'm delighted to welcome Rita Sá Machado to the stage. Rita is the Director General for Health and Chief Medical Officer of Portugal. Welcome, Rita.
Hey, Amanda.
Hi. It's great to see you again. How are you?
I'm good, and you?
I'm well. Thanks for being with us. So I thought maybe we could start. You could just give us a background on what you've been up to in Portugal. And I think specifically, you've said literacy is the foundation of healthier societies. So why do you think it's been overlooked for so long, and what changed in Portugal to make it a national priority?
Good. And I think, of course, I could spend, a whole day highlighting some of the things that we have been done, but I'm probably going to focus on two things. One is, although we created a health literacy program, and this was created quite probably, 10 years ago, but we created the program and we understand that it was not sufficient. And we just heard this, before in the chat that you were having the panel, but we understood that it was not enough to have health literacy and trying to improve health literacy. So because of that, probably 4 years ago, we included another component, and is the behavioral science component. So what we did with this specific behavioral sciences is not only we customized the health promotion strategies that we were implementing in the last decade, but we actually also understood a little bit more on the settings that we were having this, from schools, from workplaces, from, the public in general. So we made these two approaches, and for us it was quite important. Of course, and let me go a little bit behind. The first thing was to understand what was happening in the country. So we managed to do a diagnosis and to understand the levels of health literacy, and then we measure across the time. But on the behavioral science component is we also included some questions now that really ask why are, and this is always the $1 million question for every single area, is why are we not doing more? Because if you ask, a current citizen, hey, do you know what are your healthy choices or unhealthy choices? They know, and the majority of them, they will know. But how do you actually motivate them to make that change? So we have been working really close on this. And let me probably say that this robust diagnosis on health literacy and behavioral component was quite good in Portugal. Then there was another component, there was the design of an action plan. So we have concrete measures that really make us, for example, if I'm going to make a specific, and I can give you examples on this,
Great.
but if I'm going to implement a specific program, how can I include a behavioral science also on that implementation? And we have been doing this, and it was quite helpful. And one good example was on the immunization component. So far, Portugal has been a quite good country for immunization coverage purposes. And I'm not talking about only, the national immunization plan, but I'm also talking about seasonal flu, because currently we still have, between 70 and 75% on seasonal flu and on our cohort. And if we look at around 65 older, and if we look at COVID, of course, we decrease, but I'm not talking about that. But what I will say is including the behavioral science component, really make us increase our immunization rates in the last years. So it was quite good to see this. And of course, I can explain how we did this. But I want to also say that was two more things that we did. We also tailor communication and really to the individual, and to the context. And another thing, it was we really build health literacy ecosystems. So we really made sure that people were really make their choices, and we were trying to foster that choices to make it, good for their health.
Interesting. And all of these efforts have achieved really impressive results. Now there's 7 out of 10 people in Portugal that are reporting high levels of health literacy. You talked a little bit about incentives, meeting people where they are, concrete measures to know, if these efforts are successful. Can you talk about sort of among those or any additional factors? What were sort of the most decisive factors that you felt led to the success, particularly around increasing health literacy levels?
So one of them, it was to create the program because, again, it gives us a little bit of political leverage. It gives the compromise and the commitment, not only for the public to understand that now this is an area of a priority, but also on the political level, they can also, this is a priority for the country. So I would say that never underestimated the fact that there is a national program on something because, again, it gives us this commitment. Another thing, it was really to conduct the national assessments and the development of specific action plans because we in Portugal, and this is a rule, we don't really focus on the, really on the strategies. We really have really action-oriented plans because, again, we need to measure them and we need to evaluate, and we put a lot of effort on evaluation. And another thing, it was really to implement the community-based programs across the life cycle with this component. And let me, Amanda, give you probably a few examples. One of them, it was to really engage micro-influencers in the community to promote key health messages. So, for example, we really put a network around the country of micro-influencers, people, and when we want to launch something differently or want to, for example, if we are expanding a health program, if we are expanding something, we connect to these micro-influencers and we give them specific communication tips. Like this is, the things that are coming new. So they really spread the word in a sense. So we call it, the micro-influencers. And it has been quite interesting to see.
Sorry
Yes.
to interrupt you. Can you give an example of who a micro-influencer is?
So it can be, a priest. It can be the person in a store that is a store that is quite well visited in that specific city. It can be, the student at the school. So we have a wide range of micro influencers.
Interesting.
So it can be me, it can be you. So it can be a lot of us. So this is one a good, I believe, kind of so far a success story. Another thing, it was to include, so in specifically on, not on cities, but specifically in rural areas. So the security forces have an area to be more proximal to the citizens. So they sometimes know if that's specific person is living alone, and they go there and they visit quite regularly. Of course, and I'm not talking about the health system and especially health professionals because they already do this. I'm talking about beyond, the health system. So usually the security forces, sometimes for seasonal influenza and for the winter, they go there and they give specific message. You should not forget to drink your water. You should not forget to heat your home. You should not forget to get your shot, your flu shot. So again, we have this quite interesting component. Another thing that I might say, and this is a quite good example, I believe. So we all know that, today we live in obesogenic environments, and we all know about, marketing of unhealthy foods. So one of the things that we saw that was quite important to tackle, and this was in 2019, we really developed, and we were the first countries to adopt a comprehensive and mandatory food marketing restriction in the country. So we did this for children. Because again, this is an area that we want to really, and we have been now seeing a slight decrease on the prevalence of obesity in children. So we really, we implement this measure, and once we implement this measure in 2024, we did an evaluation of this measure. And when we evaluated, we saw that actually the industry were making a compromise, and they were doing things correctly on the marketing level. So they say, okay, we are not going, and they were enforcing what was mandatory. But of course, and as you might guess, we have a problem with social media and on the digital sphere. So because of that, in 2024, after the results of this report, we launched a guide specific for social media influencers, and we launched this guide on about the marketing of breast milk substitutes and baby foods. So we arranged a kind of a close meeting with these influencers of social media that really tackle health issues. They tackle, baby and maternal components. And on that, we presented the guide, we given them, we established the conversation, and afterwards they really did two things that for me were quite impressive. First of all, they really made, of course, their social media content around this. So there's this guy, this message, so the substitutes, they should only be used on this, this. And after, some of them that they had publicity and they were paid by this, baby foods and substitutes, they really said, I'm going to end this, and they say publicly in their social media accounts. So they ended this kind of relationship in the industry. So for us, it was quite an interesting, again, because I said, I'm talking about regulation and we continue to invest in regulation. But again, we focus on literacy and who is, there to really present the literacy component. And we also are really engaging with the citizens. And we all know that currently the digital atmosphere is where we should invest more when we are talking about adolescents, children, and even, baby and maternal. It's an area that we should invest more.
Really interesting. So many great examples there that I'd love to dig into. But I, I think we talked a lot about the successes and what's going well, but none of this could have been easy, right? So, can you talk to us a little bit? Sort of, what are the hardest barriers? Is it misinformation, lack of trust? Is it socioeconomic inequities? What are some of these things that you've really had to address head on to be able to make this progress?
I think the barriers are, we all know the barriers. And of course, socioeconomic features are the ones and the most critical ones. And of course, at the health sphere, and for me, I'm the Director General of Health. So of course, I give some guidance and propose some things to the government. And I highlight the fact that poverty, that the social economic status have a huge impact on, the current status of the health in the country. But what more as a barrier, I would say that more focused to this area was the kind of misinformation. So what we try, and not only misinformation, disinformation. So what we really tried to was to put an effort on this communication point. And we really tried. And I was just, probably 3 months ago, I was discussing with an influencer that has a lot of followers in the country, and and he was saying, sometimes you put forward a nice program. Sometimes you put forward a nice norm and standard. Sometimes you do things very well, but they don't get to us. For him as a health professional, because he's an influencer, but a health professional, a physician. And for me, of course, I get through to the professional and to the work side thing. But the public doesn't get this. And if they do not get it, they will just get the information where it's, for him, where he goes. And I could name several digital platforms that the person, and there is a difference if you are 50 or if you are 30 or if you are 15. And we need to adapt to all these platforms. Although I have to say, I don't know anything about the platforms that the adolescents now do or the young. But I don't care. I use what exactly we have, and I commit to the people that know how to do this. So let me go back to the example that he gave. He says, people want to see a face. People want to relate to what you are doing. So if you are put now outside a new campaign, and I don't know, for this time, for the first time, we included babies in our seasonal flu campaign. They say, you need to put it not personal as a personal thing, but give a face, give a health professional face, because this is what people want. They want to really establish a little bit of a bond, to then make sure that they are going to their pharmacy or they are going to their primary healthcare or to the hospital to get their shot. So, and it has been interesting because we have very good now, we started to do this because it wasn't a suggestion. I said, why not? Should we start it? So we started to do this, and we get good commitment. And so far, in the first week of our seasonal flu, we have possibly, and in the first year, 30% of our. So we are seeing that the children that we are immunizing, if we continue, we probably will have a 30%, what is quite good on the first year that we are implementing something new. So let's see.
Interesting. It's so useful to have this data about sort of investing in health literacy and the direct health
Yes.
impacts that it has. We're out of time, but just briefly, and it may be what you just said, but if you had to give one piece of advice to a country that's just beginning to design a national program for health literacy, where would you tell them to start?
I would say that gather the people around the country. So we establish a council specifically for health literacy and behavioral sciences. And it's an advisory council that really, gives us a little bit of insight. But one good advice that I always give to is, please be bold on what you are doing, because we need to continue in several fronts. It's not only enough to focus on the health literacy program. We need to continue making sure that we design the best policies and the regulations in the country to help us. So it's kind of a synergy act. So we need to really go up to the fronts. So if you need to start this national literacy program, you need to continue investing on the other fronts. Another thing is, don't forget that when we talk about literacy, we are really talking about different kinds of literacy around the spectrum. So from, toddlers to the elderly. So we really need to cover this up and really adapt, be flexible on the approaches that you have specifically for some settings and specifically for, and really, and this is the last one, really listen to your neighbor, because sometimes, what works, and in my case, what works in Lisbon doesn't work in Porto, doesn't work in Viseu, doesn't work in Faro. So really make sure that that community perspective also is bringing to the upfront on the health literacy, because otherwise we are not going to make it. But I'm a very positive person, and so far we will going to make it.
Wonderful. Thank you so much, Rita.
Thank you,
Really
Amanda.
useful to hear this example. So thank you.
Thank you.
Thanks for being here.